Clog TV.
Beyond the policy.
So welcome back to the KOKO Digest Morning Show. If you're just tuning in, this is the KOKO Digest Morning Show, and we're about to have our main discussion, which is on breast cancer awareness. And today's conversation is definitely with our very own, our resident doctor, our favorite doctor here on the KOKO Digest Morning Show, and she's in the person of Dr. Victoria Party Newman. She's a resident public health physician at the West African College of Physicians and Surgeons, and also the CEO of Lady Bits Health and Wellness Clinic. Thank you so much for joining us this morning.
Thank you.
Yeah, you look really, really good in the pink. Yeah. Yes. See, we also trying to rep.
Yeah, this week October we are repping.
Yes. So, you're the CEO of Lady Bits Wellness Clinic. If you can tell us a little bit about Lady Bits, we'll be really grateful.
Okay, thank you. So, Lady Bits was started in 2019.
Okay.
After so many years of working and finding out I have interest in women's health, mostly more of screenings, doing breast screening and pap smears.
Okay.
And then I figured, well, why don't I create a women's clinic specifically for women? Though we take general cases, but I'm more geared towards women.
Okay.
Where we screen them for their breast to rule out breast cancer, and then also we do their annual pap smears for them. The pap smear is relation to cervical cancer. And so it started out that way. And then it got to a point, some of the women were saying, come to the office, come and let's screen the women there, come and give a talk. And that's how it all started.
Oh, okay.
So it's a whole package of, we have the mobile clinic where we visit remote areas in the rural areas, and then we screen them. With that one, it's more of sponsorship based on that, and then we render our services to them. And then as well, we have another package for corporate clients where those that do not want to come to the hospital, we go to their doorstep, and then we examine them, and then we take care of them. And then we have those that come to the clinic as well.
So you mentioned the breast screening and then the pap smear. Are there any other services you offer? Like, with women, sometimes maybe scans for the PCOS, ultrasound scans for pregnancies, infections, all those other.
So basically, we do gynae consultation.
Okay.
We also do mostly reproductive health issues in terms of UTIs and other things related to women to boost their confidence. We even have in play a psychologist who also supports women who have diagnoses that, especially with the breast cancer diagnosis, to more support them in acceptance of the disease and the way forward. So basically, we do more of the screening for the women, more of the gynae consultation. We do general consultations anyway, but more geared towards the women.
Okay, thank you very much. So before we move quickly into our breast cancer conversation, please remember that we are coming to you live on Facebook and on YouTube. Just search for Clog TV and join in the conversation. You can also send your comments to our WhatsApp number displayed on your screens. And of course, later we will open the phone line so you can call and ask your questions. So, yes. Breast cancer. What is breast cancer all about? What is it?
Okay. So like we have the cancer of the lung cancer, brain cancer, liver cancer. Likewise, we have breast cancer. So breast cancer is just cancer of the breast. Okay, and when you'd ask what is cancer? So cancer is the abnormal proliferation of cells in the body. So we have breast cancer is abnormal proliferation of cells, of breast cells is breast cancer. And usually the body follows a certain pattern whereby the cells, they go through mitosis and meiosis to help regenerate new cells. So sometimes due to mutation of some genes, like the BRCA1 and BRCA2, there could be some changes, and also estrogen and progesterone changes can also cause cancer. So those kind of changes can affect the way it's supposed to go, and then you end up having overproliferation of the cells, and then destruction of the cells around. Eventually, cancer cells going through the blood and then metastasizing to everywhere in the body. Yes.
Okay. So is breast cancer limited to only women, like the way prostate cancer is limited to men?
No, breast cancer is both sides.
Okay.
Men also have breast cancer. According to WHO, 1% to 2% of males are diagnosed with breast cancer.
Okay.
And women, we tend to have a larger breast. So our breast is more functional. So we are at risk of having breast cancer compared to men. But it does happen in both directions.
Okay. So what are the most common risk factors associated with breast cancer?
All right. That's a direct question, because most of the time they would ask what causes breast cancer. But the truth is there's no cause for breast cancer, but there are risk factors that accelerates the diagnosis of breast cancer or the eventuality of you getting breast cancer. One of such is the family history. When there's a strong family history of breast cancer, whereby your mother or an aunt or a sister, or even if your uncle has had prostate cancer, you need to be the type who should visit the Well Woman Clinic or a clinic for women to screen. Yes, to screen the breast, and then also to make sure you don't have any cancer going on in your ovary, your uterus, and everything. So family history is very strong. Another factor is nulliparity, that is not having children at all. Because the body has been programmed to have a child at a certain age. So when that doesn't happen, it causes some kind of changes in the body, mutation in the body. Sometimes that could lead to breast cancer. So if you have an auntie or a big sister who is beyond some age to have a child, I think you should encourage her to be visiting the clinic. Yes. Also, per age. Now the age bracket is coming down. Usually breast cancer normally occurs for women above, let's say, 45. But now we are having cases of 13, 15, 19 having breast cancer, and usually even the aggressive type. One would ask why. Because of westernization and sedentary lifestyle and changes that are going on, our dieting and all that. So the probability of having breast cancer is not geared only towards the elderly, but it's both directions. So age, family history, and then also diet. Like I said, eating vegetables and fruits reduces some toxins in the body, and these toxins, when reduces the breast cancer. So you notice that cancer comes out of a result of stress, out of a result of toxins, accumulated toxins. So once you detox and wash off all these things, it reduces your level of getting breast cancer, and then also boosts your immunity. Well, sometimes there are these posts and things about processed foods being very, very high, like big risk factors. How true is that? I agree. Because some of the preservatives that are used for the food can put you at risk of getting breast cancer. I admonish we do more of naturals, where we go to the market, get the vegetables, fruits, wash them very well with vinegar, salt, or whatever, and then blend it and use, and maybe keep a little for just the week or some days, than to be using preserved tomato paste and stuff like that, which continuous use of it puts you at risk of breast cancer.
So what about the food groups? Because there are also some sorts of findings about glucose spikes, high sugars, and refined sugars also being big contributors of the risk of cancer. How true is that also? So when the patient is diagnosed with breast cancer and the patient is done, we've had the treatment and all that, and there's counseling, one of the things we do is we refer her to a nutritionist. And one of the things the nutritionist will tell her
reduce your carb intake. Why? Because glucose increases in the body. When glucose increases in the body, it could be at risk of getting diabetes.
Yeah.
And when there's so much sugar in the body, it's kind of dyes out the cells.
Okay.
And it doesn't make the cells fresh. It doesn't make the body fresh. And so the tissues are not fresh. So eventually what happens is that there will be some mutation.
Okay.
It's like the normal way the cells are supposed to go deviates because of the high sugars and all that. Like it's kind of like it obscures even circulation.
Okay.
So all these things puts the patient at risk of getting breast cancer. So some types of food are worth ignoring when you have breast cancer. So you concentrate more of the vegetables and then the fruits. And some people even say this fruit, alongwin.
Yes.
It's also very good. And other things that, would boost your immune system, like the beetroots and all that.
Okay.
Carrots.
Okay.
Yeah.
You mentioned something about the gene BRCA1 and 2. Can you shed some light on that for us, please?
All right. So the BRCA1 gene and BRCA2 genes are the genes responsible for, they are the tumor suppressor genes.
Okay.
And usually they work, they are supposed to work in a normal way. There can be overexpression of these genes or not functioning well. So in that case, the cells produce, if the cells are supposed to produce like 10 cells, it ends up producing like 20. Then it goes like 50. And normally the cells have a time life. But it can go beyond even the 90 days.
Okay.
And then eventually you notice that there's some mutation going on. So people that have that particular gene are at risk of getting breast cancer.
Okay.
Yes.
So is it that everybody has that gene or it is restricted to certain people?
So it's restricted to certain people. Yes. So this actress Angelina Jolie, she had a strong family history of breast cancer.
Okay.
So she had to go and do some DNA tests to find out if she had the BRCA1 and 2 gene. She had it, and she noticed that she had to have a double mastectomy. She quickly removed her 2 breasts, not even with being diagnosed with breast cancer.
Just to prevent it.
Because the history was too much.
Okay.
Yeah, so once you have that particular gene, you need to.
So how do you check for the BRCA1 and 2 gene?
So usually it's more of a blood test.
Okay.
Yeah. So it's not common here.
Okay.
So they're able to do some DNA analysis and they're able to pick it up from there. Okay.
So is the BRCA1 gene like the PSA thing for the prostate cancer as well?
Good. Yes. We even have another type of gene. We call it HER2. That's a human epidermal growth receptor gene. That one is usually used to diagnose the type of breast cancer, to know the type of treatment.
Okay.
Yes. So usually there will be over proliferation of the epidermal cells, which causes the cancer. So usually people with that once that particular gene is picked up, they are able to know the particular treatment for the patient. And it works very well for the patient.
So, back to the risk factors. I think I also read something about, shaving your armpits and then deodorants, that when you are not, the hairs there in the armpits are there for a reason. And so when you shave them completely and you're applying these antiperspirants and all kinds of cosmetics to your armpits, sometimes you put yourself at risk of getting breast cancer. Is there any correlation between those two?
Truthfully, there's no correlation or studies that have shown that antiperspirants or deodorant causes breast cancer. But I think overuse of it in terms of probably not going towards the more organic and more sure one that is good. And then you just go to the market and buy any product and use it, and then probably have some skin irritations and all that. And with time, for over a long time, you end up having breast cancer, probably. Because it will surprise you to know that I don't want to I don't want to spoil brands, but there are some particular powders that put you at risk of even ovarian cancer.
Okay.
Yeah, I've read on a study where a young woman who had been using a particular powder and for a while, and then eventually she was diagnosed with ovarian cancer in her mid-age, and then they had to trace it to that, and then they picked some substances that was relating to that particular. So it's not everything in the market that you buy.
Okay.
You should be sure of the brand that you are using.
Okay. So are there specific ingredients probably used in these cosmetics that we should take note of, that, you know, sometimes like in the natural hair community, this is a little bit of a digression, but they say maybe if there's maybe sulfate or so and so in the product, you shouldn't use it because it causes dryness, it causes this, or scalp irritations. Are there things like that that we can also take note of with our cosmetics, maybe from lotions to the deodorants and everything?
Personally, I haven't really gone into that.
Okay.
But I know some formalin, which is used for preservation, can put you at risk of getting breast cancer or any other type of cancer that is related to the body. Okay.
So would you advise that with using these cosmetics, we should also try to incorporate the more organic ones, just like in our diet?
Exactly.
Okay.
Like the Oriflame cosmetics are very organic and very good.
Okay. Thank you so much. So let's go quickly to screening guidelines. I think this is where a lot of us, I mean, there are a lot of women that are a bit shy to go and get screened and the rest. So if you can help us to go through how do you get screened? Okay, let's start with the going to the hospital, how it's done there. Then we can talk about the personal one at home.
So we have the clinical breast examination done by the doctor or the nurse.
Okay.
And then we have the self-breast examination done by the patient.
Okay.
So I want to go more, I think I want to empower women to be able to examine their breast on their own, because it's their breast. They have to own their breast.
Yeah.
You have to know your breast. You have to actually know how it is for you to know that there's something wrong at a particular point. So yesterday I was on a show with one elderly woman who was a breast cancer survivor. She said she's a nurse, and on her usual check-in, she picked up the lump.
Okay.
Because she knew her breast, she was able to quickly pick it up. So one thing I would urge is that just familiarize yourself with your breast. So first of all, you need to have your examination done a week after your menses, because prior to your menses, your breast is very lumpy. Yes. And usually after a week after your menses, you either examine your breast sitting down or lying down.
Okay.
So if you are very endowed, it's better to lie down to even out the breast on your chest. And then if you want to sit, you can sit. So while sitting, there should be a mirror in front of you where you assess the breast to see if it's symmetrical. Usually there's one breast bigger than one, which is fine. But when there's gross disparity in size, I think you should note that you need to come to the hospital.
Okay.
And then also you notice for any change in skin, probably there's ulceration or a sore that is not healing, something wrong. Sometimes there will be nipple retraction. The nipple goes in. Some people are born with it naturally. That's why I said you should know your breast. So there'll be nipple retraction, and sometimes when you squeeze the breast, there'll be discharge.
Okay.
And sometimes you'll find an obvious lump. So you'd observe to see changes in the breast. Then you would put your hand on your waist, and then you try to dangle your breast. For the elderly women, their breasts are pendulous. So it has to flow this way.
Okay.
When it's restricted on the pectoralis major, the chest, then we know that there's something going on in the breast. So it's very important that it has to flow in the pendulous manner. Yes. So we check the breast, we check the flow, and then you now have to examine your breast. So usually the breast is divided into 4 quadrangles.
Okay.
We have the upper outer, and then upper inner, and the lower inner, and then the lower outer. Okay. So you examine per quadrangle and go round. And you would need to put your left hand behind your head, and then your right hand for the left breast.
Okay.
And then you would use the pulp of your finger to palpate
And check.
in a round mat till you get to the nipple. And then you squeeze the nipple to see if there's any discharge.
Okay.
And usually in breast cancer, there will be some lymph nodes in the axillary region. So you need to check if there are any lymph nodes, and then the clavicular region as well. And then you are done with the left breast.
Okay. So you mentioned clavicular region. Please break it down for us.
Sorry, the collarbone.
Okay.
You check around the collarbone to see if there are any lymph nodes in the armpit. And then you repeat the same for the right breast. So averagely, less than a minute, you should be able to have examined your breast.
Okay.
So women who are menopausal and are not having their menses anymore should just choose a day. So probably my birthday is on the 6th of October. So every 6th of October, every 6th of every month on my calendar, I would examine my breast.
Okay.
So just choose a day of your birthday and then just follow through every month. Make sure you examine. So when there is a change, then you quickly come to the hospital and the doctor or the nurse performs the clinical breast examination.
Okay. So are we required to use like an oil to smooth it out or something?
No, but then preferably in the shower, because the soap is on the breast and it makes like transitioning. It goes there. But,
okay. Right. So I know a survivor who did not have any lumps in her breast, but she felt something strange in her armpit.
Good.
So what is that also about? So
you know that there's something we call accessory breast.
Okay.
That's not necessarily breast here, but it can be in the axillary region. Maybe there was a bit of a breast, accessory breast in her armpits, which developed some lymph nodes. Okay. And then there was some cancer in the cells. There was some cancer in the breast cells, and then that was picked. So it hadn't even gotten to the real breast. I don't know, how is she? Did she survive?
Oh yes, she did survive.
Because such a case most probably would survive because it's quite on the early detection side.
Okay, so well, for that patient also, she mentioned that when she was doing the examination, she felt something. The texture of the breast was different. But it was not lumpy. It was just different. She couldn't really explain that. So with the education about, yes, you find a lump, what about the people that feel like it's strange, but then they haven't heard anything about a strange feeling, so they may think that
we haven't gone through the symptoms and signs of breast cancer. So one of them is, we call it peau d'orange. Okay. That's a French word. It looks, your breast looks like orange. So the way the skin of an orange feels. So that's how your breast, with those kind of dots, that should be a sign that you should come. Then usually you feel some thickening of the breast or skin, the epidermis around that side with some, calcification. You just feel there's something wrong, like you were describing. So the tissue feels a bit thicker than usual compared to the other. Like something is a bit off. Yeah. You should come to the hospital. And then also nipple discharge. There's pus, there's blood, there's serous. Serous is white. But having nipple discharge does not necessarily mean breast cancer. Okay. I had a very scary event of one of my nurses. She's now retired. And she noticed blood from her nipple. We're doing the War Woman Clinic. She noticed blood from her nipple. And that was like a scare for her. But eventually it was just something we call duct ectasia. Okay. The breast ducts had just dilated and then had pressed on some blood vessels, and then just come to the hospital and let the doctor diagnose you. Okay. And then also one thing I would also say, one differential of breast cancer is mastitis, which is mast breast. So itis is inflammation. So inflammation of the breast, which comes from women breastfeeding. Okay. So you'd have a breastfeeding mother whose milk cakes in the breast, especially when the child is not pulling much of the breast. The milk can cake, and it mimics breast cancer. Very painful, and like you eventually feel sick and septic. With such a condition, you treat with antibiotics and then maybe some painkillers, and then the patient feels better after a while. So I'm just saying this because it's not everything wrong with the breast that is breast cancer. Another thing that usually occurs with women in our age brackets is usually fibroadenoma.
Okay.
For women between the ages of 19 to like 35, 37, they usually have the fibroadenoma, which mimics breast cancer, which is not. And normally breast cancer is usually in the initial stages painless.
Okay.
And the fibroadenoma comes with pain.
Okay.
So usually one reason why I would remove a fibroadenoma, the fibroadenoma is just like uterine fibroid.
Okay.
That's fibroid of the breast, of the uterus.
Yeah.
So the fibroadenoma is fibroid of the breast, and it comes with pain and discomfort. So that would be the reason why they will have a lumpectomy, to remove the lump from the breast, not because it's cancerous. But sometimes, eventually, there can be mutation, it can change to cancer.
Okay.
Yeah. So usually there's something we call watchful waiting, where the doctor would observe to see if it's necessary for you to have the lump removed. Sometimes some parents are like, please, I'm not going to wait. Let's just remove it.
Yes, they don't. Okay. It's time for a quick break. When we come back, we will continue the conversation on breast cancer. And don't forget to send in your questions. I know a lot of our women have pressing questions to ask, and our doctor will answer each and every one of them. We will be right back. You're welcome back to the KOKO Digest Morning Show. As you know, we are in the Breast Cancer Awareness Month. So, of course, here on the KOKO Digest Morning Show, we will be discussing breast cancer with our very own Dr. Victoria Party Newman. So, we were just talking about the early detection and diagnosis. So, Doc, we were talking about screening just before the break, and I want to ask, on behalf of the girls that are just so busy with life that they don't necessarily pay attention to their breasts, but maybe from today they've turned over a new leaf. So how do you know what to look for, or how do you know maybe whatever you're feeling is wrong in the breast or not? Because you just get up, take your bath and go to work, and then continue life. You're not really so focused on knowing your body. How would someone like that be able to screen herself?
So, I was also once like every other girl. And my first experience being a doctor for a patient, my hands were trembling, examining the breast, because I wasn't sure what I was looking for. So the moments of not being confident in your breast, there are times like that. But then you should grow past it.
Okay.
So initially, you are busy, rushing to work. You've not heard wind of Pink October. You've not heard of breast. Now you know Breast Cancer Awareness Month is there. You know that you need to examine your breast monthly, a week after your menses.
Yeah.
Now you need to know your breast and own your breast. There are instances where male partners are the ones who tell their partner that you have a lump in your breast, and they come to the clinic and it's confirmed. But it's much preferred that you know your breast. So try and examine your breast. And ideally, in every woman, we have a big lump, which reduces with aging. That's how the breast becomes pendulous. So when you palpate the breast with the poking of your hand in this manner, definitely you would feel the lump. You need to use the flat of your hand, and then you press against the chest wall with the breast tissue, and then you'll be able to see if there is no lump. So if there is no lump, there's no lump.
Okay.
So sometimes I remember my mentor was teaching me on breast examination and things, and then I would examine and there'll be no lump, and I wasn't sure whether I would say there's no lump, and she'd be like, Dr. Pate, there is no lump. I'm like, yes, there's no lump. So there is no lump. So I built my confidence. So it's normal that you would definitely feel like you're not doing the right thing, but the moment there is something wrong, you pick it up.
Okay.
Yeah.
Okay.
And one of the things I've learned in my practice over many years now, I listen to my patients a lot.
Okay.
The patient feels there's an intuition. God has put in the Holy Spirit in you. It gives you a nudge, like check your breast, check your breast. So I've had a case whereby a patient, we did a mammogram, it didn't show anything. Patient came back, repeated the mammogram, it didn't show anything. Now the patient is insistent. She feels there was something wrong. I talked to her, we calmed her down, everything. She was like, after like like in 2 months, she came back and like, nah, doctor, there's something wrong with this breast. Then I was like, okay, I was just a novice knowing my work. But I noticed something was like, okay, let me listen to her. So I was like, okay, let's do an MRI.
Okay.
And there was this tiny lump that was now it was like about 2 millimeters, very, very small. And we were able to detect with the MRI.
Oh, okay.
And then she was more privileged to travel. So she said she wants to go and continue her further treatment outside.
Okay.
So listening to the patient, knowing yourself, feeling it, having a conviction, I want to check my breast. All these things come to the fact that you should be aware of your breast.
Okay. So we have a question here. We have some questions. So this one is from Kwiku, and he says, is there any truth on the assertion that having your breast sucked often prevents breast cancer? And is there any scientific research that disproves this assertion? Then he also asks, is breast cancer a woman's thing, or can men also get breast cancer? Yes. According to WHO, as you said, the percentage of men that get breast cancer is about 1 to 2% globally. So yes, men can get breast cancer. Chances are just low. So yes, sucking breast, does it?
Yeah. So
prevent?
let me put it in there that breastfeeding is very important in prevention of breast cancer.
Okay.
So I'll put it out there that women should breastfeed their babies. No matter how busy you are, try to breastfeed because it helps with the breast cancer, because the breastfeeding releases certain hormones. You know, some of the breast cancer are related to hormones.
Yes.
So we have treatments whereby they use the hormonal therapy in treating it, and then it subsides.
Okay.
So breastfeeding is very important. Now let's go to the question with the sucking of the breast. So there's no study that shows that a man sucking a woman's breast reduces the risk of getting breast cancer. Yeah, there's no study like that. But usually, when there's lovemaking, there's this hormone called oxytocin, which when released, usually it's the same oxytocin that is released during breastfeeding as well, which helps with the bonding of the mother and the baby. So that oxytocin also helps with the bonding of the two partners when making love. So there isn't a clear study saying that sucking of the breast reduces breast cancer, but one study I read to one article was inferring that should the breastfeeding of a baby reduces the risk of breast cancer, whereby oxytocin is released, and the same oxytocin is released during lovemaking, why would you not think that it helps? It does, in a way.
That doesn't mean you should abuse your partner's breast too, please. So this is also from Mr. Asari from Bono region. He says, Doctor, I know of a lady who died of breast cancer at age 25. May her soul rest in peace. To my question, is it true that breast cancer happens to people who have big breasts? Thank you.
Okay, so that is a good question, because normally why people would think breast cancer happens to people who have big breasts, like I said earlier, breast cancer can occur both in males and females, but more in the female because the breast is bigger. So when you have a bigger breast, you have bigger breast tissue. So probability of the lumps hiding is very, very high. So the doctor would examine, say there's no lump. Then that's why it's important you do the imaging to pick up the scan. So that question of having bigger breasts, being prone to breast cancer is no. But the reason why it might not be picked up and it might look like more of the people with big breasts have breast cancer because their breast is big and it isn't well examined, or some of the imaging is not well done. So for someone who is well endowed in the breast, you need to be very patient in your scan. You need to be very patient, tissue by tissue, go around. Even in your examination, very, very patient to pick up.
So I have another question. This one is, hello, KOKO Digest, good morning. I love doctor's discussion. How often should I perform self-breast exams? This is from Ikea Martina from Cape Coast.
So we said that earlier, a week after your menses. Your
every
menses
month
comes monthly.
So monthly, a week after your period, you can perform your own self-breast examination. If you get the chance to, you can visit any medical facility, preferably Lady Bits, and then go for a professional screening to check yourself. So, Doc, signs and symptoms. But I think before we get to the signs and symptoms, I wanted to ask Oh, this question is okay. It will come back to me. Let's go to the signs and symptoms. What are some of the things we should look out for to know that breast cancer may be on the way?
Yeah. So, like I said, your skin, there's there irritation. So usually for fair women, there will be reddening, ulceration, sores that don't go.
Okay.
And then also there could be dimpling, whereby there will be some retraction of a part of your skin because the lump is pushing against the chest wall.
Okay.
There could also be discharge from the breast, specifically pus.
Okay.
Yeah, like how when you have a boil and the fluid comes out,
Yeah.
it's the same pus that can come from the breast. It means that there's an inflammation or something wrong with the breast. And sometimes there could be, but mind you, some people have milk from their breast.
Okay.
And those ones have issues with, the last time we talked about the
hormones,
PCOD.
prolactin.
Yeah. So it has to do with fertility and all that. So that's a different thing. That's why when you examine your breast, you just come for a doctor to confirm what exactly is going on.
Okay.
So you check for the changing in the skin, the discharge. We have something we call nipple retraction.
Okay.
It can be natural with people, but some people's own, that's why you should know your breast. So a time will come, you notice, this particular breast is going in. What's the problem? Then you bring it for examination, okay? And I spoke earlier on about the podorange, whereby it looks like an orange, very hard and dotted with thickened skin.
Okay.
Yeah, thickened skin. And that should be a sign that you should come to the hospital.
Okay. So why does this question keep escaping me? Yes, I wanted to ask about the hormonal breast cancer. What is the difference and how do they detect that this is hormonal breast cancer and then this is normal breast cancer, so to speak?
All right. So we have types of breast cancer. We have the triple negative breast cancer.
Okay.
Usually that one has to do with the breast cancer, the cancer cells have no estrogen receptors, no progesterone receptors, and no HER2 receptor. HER2 is the human epidermal growth factor receptor. Those are the things that trigger the overproliferation of the cells.
Okay.
So when it's like that, we call it a triple negative type of breast cancer. And there's also a type of breast cancer whereby the estrogens and the progesterones causes the breast cancer. So they have that particular receptor, and the overproduction of over excess of the estrogens will cause overproduction of the cells. And then, so normally with those particular breast cancer, when the hormones are the cycle of how the hormones come, like they are intercepted, that's the word. When they are intercepted, there's great reduction in the tumor.
Okay.
Yeah, there's great reduction in the tumor. One medication, I think tamoxifen, there's great reduction in the tumor, and then it suppresses the tumor, and then they can have the surgery, and then radiotherapy comes in. So the hormonal, should I say the estrogen-related breast cancer is also there. Then we have the triple negative, and then we have the human epidermal growth factor that causes overproliferation of the cells that leads to. So there are different types of breast cancer for different types of treatments.
Okay. So if people like, even now we have a lot of ladies dealing with hormonal imbalances. How should they sort of live their lives to be able to avoid anything, maybe the hormonal kind of breast cancer?
So one of the risk factors of breast cancer is the OCPs, the oral contraceptives.
Okay.
So you need to be managed with like a doctor. You need to have an endocrinologist. Once in a while, perform some labs to find out how your hormones are faring. Your estrogens, your progesterones, your testosterones. I told you earlier on the other time that women have a bit of testosterone. So the level should be within a certain level. All those things have to be managed, yes.
Okay. So, now let's go to diagnosis. We have the screening and things done but are there any other ones? I think I've heard of the mammogram. What's the mammogram about? And then I think MRIs and then a biopsy. So if you can shed some light on that too.
All right. So a 40-year-old woman, women above 40 years, they do the mammogram. Mammogram is a simple X-ray of the breast, as we have chest X-ray, X-ray of the leg, X-ray of the breast. Why X-ray of the breast? Because for women above 40 years, their breast is less dense, and so there's penetration of radiation. Okay, and they are able to pick up the lump. Women below 40 years do a breast scan. The breast scan mostly is for, you see, when you are pregnant and you want to check the sex of the baby, and baby is fine. That particular scan, the same probe that is used to check. So we use that probe to see if there's any lump, tissue by tissue. They go around and then they pick up. So that is the scan, and then we have the mammogram. The MRI, it's higher resolution, magnetic resonance imaging, more than the ultrasound and then the mammogram. That is when you really want to be sure and you really feel you are not seeing much with the previous images I mentioned, yes. And then we also have the biopsy. The biopsy is a conclusive diagnostic procedure whereby a true cut needle is invasive. It's pushed into the breast tissue, specifically by ultrasound guide, to know exactly where the lump is. And then some tissue is picked, sent for cytology and microscopy to see what particular cells are growing, if it's cancerous. Yeah.
So, let me ask this person's question. So I have another question here. This one says, I'm enjoying KOKO Digest topic, very educative and informative, as said by Ira most often. My name is Mrs. Joanna Sante. Doctor, what if I'm pregnant or breastfeeding and diagnosed with breast cancer?
Yeah, it happens. So my predecessor, Dr. Deban, would also say, doc, whenever you're examining a patient, make sure, even if the patient is pregnant or the patient is, if the patient is pregnant or the patient is breastfeeding, examine. But there are ways and techniques to do for them. Okay, because normally with pregnancy, the breast is tender and lumpy. So you would examine, but with a mind that is lumpy. So we wouldn't be too expectant of saying that, your breast is lumpy, so you have cancer. But then you would examine and feel. If there's something off, you would know, and then you would do the scan. For a breastfeeding mother, you would examine, but you wouldn't have to squeeze the nipple, because of course milk will come out. So there are ways, but they should never be exempted from doing a breast scan or a mammogram if breastfeeding can do a mammogram. But with pregnancy, you can't do the mammogram. But you should never be exempted from doing imaging. Because I've encountered a patient that was pregnant and had issues with the breast. We thought that the patient was actually having breast changes. You understand? Breast changes with the breast. And that I think I wrote an article concerning miscarriages and abortions causing breast cancer. You know, the pregnancy has a way of regulating the estrogens and progesterones. So what happens is that when you are pregnant and it's supposed to follow a certain course in your estrogen spike or whatever, what happens is that when you abort or you have a miscarriage, there's a sudden drop. And that continues. If another abortion happens, another one, or miscarriage, that continuous thing kind of destabilizes the body and can put you at risk of getting breast cancer. Yes. So that women that have had several miscarriages, I'm putting it out there, come to be checked. So yes, again about the pregnant mother or breastfeeding mother. So if it's confirmed that she has breast cancer, is she allowed to continue breastfeeding? No. We stop breastfeeding. So what happens is that we stop breastfeeding immediately, put the baby on formula, and then we concentrate on the mother. We've had a case whereby a woman was diagnosed with breast cancer. She was pregnant, but it was diagnosed like around 32 weeks. So she had about 8 more weeks to go. So what we did was we had to put on hold treatment, everything, and then wait for her to deliver. And then so the baby was never put on breast, and then we started treatment for her. But she's
survived.
alive. Yeah.
Okay, that's great. So yes, I have. So the person who asked about the sucking and then things. So he says, thank you for the information. I missed the discussions earlier. Pardon me if you already said that. I missed it. I want to inquire about the hereditary nature of breast cancer markers. Specifically, I would like to know if women from families with a history of breast cancer are more predisposed to developing the condition. This is from KOKO in Accra. Yes, please, they are. We also mentioned that earlier. So the stages of breast cancer, we've been hearing stage 4, stage this. What are they, and how dangerous are they, or what is the most dangerous stage?
So we have stage 1 to stage 4. Stage 1 is when you find a lump less than 2 centimeters confined in the space. Stage 2 is there is a lump from 2 to like 5 centimeters now spreading in the breast tissue. Stage 3, 2 to 5 centimeters spreading in the breast tissue with lymph nodes in the armpits. And stage 4 is when the whole breast is destroyed and spreading in the lungs, the liver. There's metastasis to the whole body. And so stage 4 is when you are dying, or you eventually die. And stage 1 is the early detection. So the whole emphasis of Pink October, we are stressing on early detection, because once it's detected, the chances of survival is 99%. And in stage 4 is 1%. So that's the disparity of it. I don't know if you would have more time. I wanted to share a story.
We do have a little, but we also have questions here. So this one says, thank you for touching on oral contraceptive use. Too many young people are abusing this. I think you should explain that one. Is it the post pill or the combined oral contraceptive?
Both. In fact, the post pill is even more toxic because there's a high concentration of the estrogens. So post pill, we are not talking about that today, but I want to put it out there. Please do not regularly use the Postino 2 because it's for emergency. When something is wrong, you use it once in a while. Try to go to a family planning unit and get a type of contraceptive that will suit you. They'll show you different types and then you pick it up. If you want the orals, the injectables, they are all there. But to decide that you would always have sex and use the Postino 2, you are injecting a lot of hormones in you. You'd end up having disrupted hormonal cycle, and then it ends up giving
you issues.
Yes,
okay, so this is another question. It says, I'm always late on KOKO Digest Morning Show. I'm Mr. Robert Amankwa from Kumasi. My question is, are there any lifestyle changes I can make to reduce my risk? I think we mentioned that earlier.
So the risk factors are the opposite of the lifestyle changes. Like eating well, diet, vegetables, fruits, exercise, cutting off stress, resting, very important. Drinking a lot of water, also very important because it detoxifies you.
Okay. So can you share maybe it's implied, but if you can give us the importance of early diagnosis and the self-examination.
So, like I said, detecting it early is very important. So there was a study that was done in the Western world, where they surveyed 100,000 people from Asia and 100,000 people from Africa. So from Asia, they had, I think, 95 people were diagnosed with breast cancer, and from Africa, 25 were diagnosed with breast cancer. Now, you would now ask, how many people died after they were diagnosed? In Africa, it was 22 that died from the breast cancer. Yeah, the study. Yes. And in Asia, it was 3 out of the 95. Why would this happen? I think what's their motivation over there is the early detection. Because they are trained to be proactive about their health. Anything wrong, they go to the hospital. But would wait. Usually, studies have also shown that 70% of cases brought to Kolebu annually are advanced. That much cannot be done. We will only end up having palliative care. Palliative care is like, you are going to die, but we are helping you to become. Exactly. So you would look at, so the early detection is very important. So every woman needs a baseline breast scan. I prefer by 21, you should have had your first scan. You keep it in your record. After 22 or 23, another one. So there will be comparison. 26. So finally, eventually if there's something picked up, it's picked up early.
Okay.
And then, like I said earlier, once picked up and treated, you are good to go. Then you'd wait. Some people, another thing I want to put out there is people go to prayer camps. Please, God gives wisdom to doctors to help you.
Say it again, oh.
There was this woman yesterday I was with, a breast cancer survivor. She's a nurse. Detected a lump in her breast. And she went to the hospital.
Okay.
And then they said they had to do the surgery because it was the aggressive type of cancer. So they had to do the surgery for her within a short time. Before she had the surgery, she also went to pray. And God told her that he would heal her. He would heal her. But she eventually went for the surgery. And when she went for the surgery and she went to the recovery ward, she said she had a dream. And in the dream, she saw that she was on a trolley and there was normal saline on her. And she was actually going back and forth, but she could not see anyone around in the dream, in the recovery ward. The following day, she came to the hospital. She came to the doctors and nurses came, and then she now knew that what happened in the dream was that Jesus had given her chemotherapy.
Oh, wow.
So the same chemotherapy was given to her physically, but already the healing had taken place spiritually. You understand? So she combined God with medicine. She never said she wouldn't go for her surgery.
That was very smart.
She never said she wouldn't go. And she never rejected the medication because she had seen in a dream. So just allow God to use doctors to heal you.
Thank you so much for that. We need a lot of our mothers especially to actually emulate this story you just told us. So we have a few more questions. I even have my own personal question. Let me ask first. So how does breast cancer, what's the word? Is it contraindicates? I don't know. Along with underlying health conditions like arthritis, diabetes, kidney issues, or hypertension. When you get breast cancer, what happens when you have all those kinds of issues?
When you get breast cancer and you have underlying conditions like diabetes, hypertension, arthritis, which usually comes with aging, you know, breast cancer itself, your immune system is compromised because of chemotherapy.
Yeah.
It suppresses the immune system, to kill the cancer cells. That alone aggravates your comorbidities or diseases that you already have. So you need exceptional attention by your doctors. More like direction to go to the hospital. Like you should go to the hospital as soon as possible when you see symptoms. So usually someone with breast cancer who is diabetic, your sugars have to be controlled.
Yeah.
Hypertension, your BPs have to be controlled. Arthritis, you need to be going through some physio examination, exercise, and all those things that would help you. And you need to eat right. So normally, it's like the breast cancer comes to aggravate the other conditions that are there. Yeah, so I think on the whole, you need extra care. Yes, you need extra care.
I think we have a few more questions here. I'll just read them quickly. So this one says, Doctor, if you suck a breast with cancer, will you be affected?
No.
And then it says, Doctor, please, so this is Aman. He says, please, those who are doing breast surgery, if they get breast cancer, what are the consequences? Like the breast augmentations, those BBL things that have come up these days. Then, please, the checking of breast cancer, does NHIS cover it?
Yes. So the NHIS doesn't cover everything. It covers partially. Okay. So I think this is a word out to the government that breast cancer should be a condition where it should be covered fully by the NHIS. So now some drugs are covered, but not everything. Okay. Yes. Okay. So the last question, this one, I think it's an important question that we can answer quickly before we wrap up. It says, hello, as you mentioned the stages of breast cancer from stage 1 to stage 4, what is the time duration between the stages? Does it take, say, 3 months interval or some years interval? This is from Irama Ashoman Estates. So usually there is no time frame. It's based on the type of cancer. Okay. Some cancers are aggressive. When diagnosed, within like a year, you are gone. Some can be there for 5 years. So I actually had this patient who was diagnosed with breast cancer. She didn't believe. She's a corporate client. She didn't believe, and then went away 3 to 5 years, came back, and was like, "Doctor, I think I'm ready to remove the." But when she came back, the lump was still
very small.
Yeah.
Oh, okay.
So it means it was a slow
progression.
Yeah.
Okay.
So it depends. It's relative.
Okay. This conversation has not ended, definitely not. So next week, Thursday, we will continue this conversation. I hope our doctor will be available. And we'll be talking about treatment options and management. Then we will go to survivorship and support. I know our women out there like to be communal and help each other. Then, of course, we will also talk about the research and awareness. So even as today's show has ended or is ending, it doesn't mean the conversation has ended. We will continue next week, Thursday, to talk more about breast cancer so that we can educate and inform you, as the policy of Clock TV always is. So thank you so much, Dr. Patti. We hope to see you next Thursday to talk more about the breast cancer. As we are in the Breast Cancer Awareness Month, we will exhaust the month talking about breast cancer. And a big thank you also to you, our viewers. Thank you for your comments. Thank you for supporting the KOKO Digest Morning Show. Thank you to our production team, our management, to our guests, everybody that's contributed to making this show a success. We hope that as you go through your day, you have a bright and beautiful day. Our motivational quote says we should spread love. So as you go through your day, please spread love and make sure you are also being loved. Thank you so much, and we will see you bright and early on Tuesday morning. Do have an enjoyable weekend ahead.
Clog TV. Beyond the policy.